Good, happy Sunday afternoon, everyone. I'm Riley King, and welcome to this afternoon edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news this afternoon, so let's begin. First up, New Hampshire Senator's spouse tests positive for coronavirus. Martha Fuller Clark and her husband have been in isolation since March 17th. New Hampshire Senator Martha Fuller Clark announced Saturday that her spouse has tested positive for COVID-19. Fuller Clark has yet experienced any symptoms of the virus herself, according to the state senator's policy and communication director. People who were in close contact with the senator between March 7th to the 15th are advised to follow state guidelines for at least 14 days to protect themselves and others. Fuller Clark urged people to stay home, saying it is better to protect yourself than reactivate. Dover police find missing man with Alzheimer's. The missing man was found Sunday morning by Dover police after he went missing from his home early Saturday afternoon. Take a look at this photo of the missing man. This man went missing yesterday afternoon on Saturday. Scott Ogilvie was located by Dover police on Sunday morning after he went missing. As a precaution, he is being transported to a hospital to be checked over. Police in Dover, Massachusetts searched for the 64-year-old man suffering from Alzheimer's disease. Ogilvie was last seen leaving his home on foot Saturday morning at 11 a.m., police said. He is 5 feet 6 inches tall and was wearing a beanie North Face jacket with a tan cargo pants, glasses, and a baseball cap. He was also carrying a white canvas bag with blue straps. Dover police want to thank the public for their help in finding Ogilvie. Coronavirus pandemic prompts Maine Island to ban visitors. As of Thursday, Maine has 52 COVID-19 cases. As the illness spreads, one of the state's island is taking extra precaution. Late Sunday, leaders on North Haven, which has about 350 to 375 year-round residents, voted to ban anyone who isn't a full-time islander from going there. The reason for the strict measures is to prevent coronavirus from overwhelming the island first responders. Cooper says the decision simply came down to resource. The ambulance director for North Haven EMS. With only one nurse practitioner on the island and limited availability to fly a COVID-19 patient off the island by airplane, the preferred method for the emergency transport, a positive virus case requiring hospitalization would essentially leave the island without emergency services for hours, while an ambulance transports a patient on a ferry. Meanwhile, on the mainland, other precautions are being taken to keep islanders safe. The main state ferry service is no longer physically verifying tickets, but instead just looking at them. It is also scrubbing down vessels, including tables, sinks, and seats before every departure. Pensacola Island Air, which typically carries mail, groceries, and islanders around, is also disinfecting aircraft regularly and conducting health screenings on passengers before they board the aircraft. Waters admits the decline in revenue from COVID-19 is causing some financial hurt the airline's owner. He has scaled back 35 daily flights to just 12 and made staffing adjustments, but he has uncertain about the virus impact on summer travel is causing some unsense. 20 new cases of coronavirus in Vermont, including 7 at nursing homes. Vermont health officials announced 20 new cases of the coronavirus on Saturday, including 7 at a nursing home, bringing the state total to 49. $223 cases of the coronavirus now in Connecticut. State announces 5th death. 223 people in Connecticut have now tested positive or are presumptive positive for COVID-19. According to sorry about that. According to most recent testing data released by the state on Sunday. Of those cases, most are in Fairfield County. The state also announced the 5th death of a Connecticut resident for coronavirus. Rhode Island governor to provide update on coronavirus outbreak. Rhode Island governor will hold a press conference Sunday afternoon to provide an update on the coronavirus in the state at 1 p.m. this afternoon. President Trump has not invoked the Defense Production Act, despite healthcare workers' critically need for medical supply. Kelly O'Donnell has the full report from NBC. Let's take a listen to that video from NBC News.
President Trump says he is not yet ready to invoke the Defense Production Act, which would allow the federal government to direct companies to manufacture goods and supplies for the effort to fight the spread of coronavirus. NBC's Kelly O'Donnell is at the White House with more on that angle. Kelly, good morning.
Good morning, Willie. First, an update on the vice president. Test results came back for Mr. Pence and his wife, Karen. They were tested Saturday after a staffer in the VP's office was confirmed to have coronavirus. The Pences do not. Today, the task force Pence leads will brief the public again. Saturday, officials here said the national availability of tests has increased, but they urge that tests be prioritized for hospitalized patients and healthcare workers to conserve those medical supplies like masks and gowns. Now, the president has has resisted calls to use a specific presidential power to compel American businesses to make these needed medical supplies. I pressed the president Saturday on why he has not used the Defense Production Act. He said forcing businesses is not yet needed, and instead he praised American businesses that are voluntarily manufacturing these masks and other supplies. Officials have been unable to say when shortages would be eased, but they acknowledged it may take weeks. President Trump is also using his influence to launch a clinical trial in New York for patients already sick with the virus. Now, although there's no scientific evidence yet, the president says he believes specific medications approved for other illnesses should be given to very ill coronavirus patients. This has been tried in other countries with some anecdotal success. Dr. Fauci said more evidence is needed, but doctors can consider this an option for their patients. Willie?
All right, Kelly O'Donnell at the White House. Kelly, thank you very much.
Okay, and there you go on that video and that report. And that does it for this afternoon edition of the Riley King Newscast, right here on the Riley King Network. I hope you all enjoyed watching. Have a great rest of your Sunday afternoon. See you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.